Shawnee the MP here. Welcome back to my channel. If you are new here, thank you so much for tuning into this video. If you are a subscriber, welcome back. Don't forget to hit the like button, hit the notification bell so that you're notified every time I post a video, and leave me some comments down below because I do read them and I do take recommendations from you guys as to what topics you would like for me to discuss in the videos. I kind of was just sitting and thinking, you know, what can I discuss in my next video that I feel could really help my subscribers? And the one thing that came to my mind and just wouldn't leave was prescribing narcotics, because when I initially started as a new grad nurse practitioner, that was something I kind of just shied away from. I would ask other nurse practitioners and they would tell me either don't do it or that they did it and they just followed their state nurse practice act. So you had some nurse practitioners who were more comfortable than others. It just takes time for you to become comfortable with prescribing in general. So I just wanted to create this helpful video, just some guidelines you can follow, hopefully alleviate some stress and help you guys out when you're coming across patients who have chronic pain. Let's just do a patient case scenario. Just say you have a patient who you have been seeing and managing their care, and they have an acute injury and they're requesting something for pain. Okay, that is understandable. In that case, I would recommend prescribing a non-narcotic, maybe some ibuprofen at a higher strength that they can take. And typically, as the acute injury resolves, the pain should resolve. The problem has been fixed. However, if a patient who you've never seen before and they're on all of these medications, like they're on muscle relaxers, they're on benzos, they're on maybe tramadol, and they're having this pain and they're requesting narcotics because maybe they've taken them in the past and somebody discontinued them, but they're not sure why, and they really need something for pain. So as a new grad nurse practitioner, I felt sometimes like pressure, like I don't want my patient to be in pain, but I'm really not comfortable prescribing oxycodone or Percocet. And that is a normal feeling you're gonna have because you're new to prescribing medications. Now, the first step that you're gonna have to take, you should already know if you have prescriptive authority. That should be on your license. In states where you do have prescriptive authority, you need to know if you can prescribe narcotics or not. So in the current state that I live in, I can prescribe narcotics. So then the question becomes, okay, I can prescribe narcotics, so how many days of the medication can I prescribe? Because that varies based on your state. I can only prescribe 5 days of a narcotic if I am the person writing a new prescription. You live in a state where you don't have full practice authority, you'll have a collaborating physician. Then my state practice act goes on to say, after the 5 days, your collaborating physician, if you are living in a state where you do have full practice authority, then you would just follow your state nurse practice act guidelines. But I live in a state where I have a collaborating, so he would have to rewrite that prescription for 30 days. Then I can write the prescription for 30 days. That's in regard to narcotics. That's why I say it's important for you to review your state nurse practice act. Even it changes based on the setting I'm in. I work in a long-term care facility on the weekend, and the state nurse practice act says that I can prescribe 30 days of a narcotic in a long-term care facility, but it has to have already been written initially by a physician. And then in regard to hospice and palliative care, because I do see both hospice and palliative care patients, I can write 30 days for a narcotic in those instances. For me personally, I'm going to refer my patient to pain management. If it's a new patient, I'm going to review their medical records. You want to do that anyway, but you're wanting to look for any type of history of substance misuse. See if there has been any frequent ER visits for pain, any past prescriptions for pain that have been discontinued, and see if there's any documentation as to why they have been discontinued. And then also, and I'm not sure if this is nationwide, but the state I currently live in, there's a prescription drug monitoring program that providers sign up for, and literally it tells you when the patient last had a narcotic or a sedative prescribed. I always use that. Even if it's a patient that I have been seeing for a while, I always look at my prescription drug monitoring program just to make sure that the patient hadn't gone somewhere else and had it filled 2 days ago, and now I'm rewriting a prescription for the same thing. We would hope that pharmacies would catch that, but you know, they're filling a lot of medications. They can't keep track of everything, so it is ultimately our responsibility to make sure we're reviewing that information. So just say you then, you know, refer your patient to pain management. The referral gets denied, which does happen because a lot of times these offices aren't accepting new patients. They're just booked, filled with patients. And it's not that, you know, anything's wrong with your documentation or they just don't want to take the referral, but that's just the reality of it. They have too many patients. So in that case, you want to refer your patient to another pain management office. If they're constantly getting denied, then lastly, I would recommend referring your patient to palliative care, because palliative care does manage uncontrolled pain. Pain management is great because with pain management, they're creating a pain contract with the patient. So the pain contract, it allows the patient to take responsibility for taking the narcotic. It says, I know that I'm taking this narcotic. I know that I cannot take any other substances outside of this narcotic for my pain. And if I do, then I could potentially be discharged from pain management services. So that's why pain management is so important. And that's why it's important for you to get comfortable referring your patient to these specialties. So in my personal opinion, the best way to protect your license is to refer your patient to pain management and let them manage that patient's care, because they're going to be monitoring the labs, doing the urine drug screens maybe monthly or every 3 months, depending on what that contract states. And it's just going to allow you to manage that patient's chronic issues and acute needs. And that's what will alleviate some stress from you as a new grad nurse practitioner. So first things first, review your state Nurse Practice Act. Know whether you can prescribe narcotics. If so, you need to know how many days you can prescribe the narcotic for, and protect your license. Don't prescribe anything that you're not comfortable prescribing. Don't allow the patient to coerce you into prescribing anything that you just don't want to prescribe. Pain is what the patient says it is, and that is still the case as a nurse practitioner. But you also want to make sure, again, that you're doing what's best for the patient, that you're still protecting your license, and that you are making the best medical decisions for the patient. I hope you guys found this video helpful. I hope this alleviates some stress for you guys in regard to prescribing narcotics. If you have any questions, feel free to leave them in the comment box down below. Make sure, if you have not already, like the video, subscribe to my channel, click that nice little bell in the corner, and I will see you guys in the next video. Thank you so much for watching.